and the opportunity to present here during the conference here in Kuwait. To introduce myself, my name is Jen Payne. I'm the Senior Director of Upstream Marketing for Unveiling Technologies, based out of Paris. The topic I would like to talk to you this afternoon about is related to weight loss and the use of artificial intelligence and how that can help us to enhance patient care. And mainly we'll be focusing on a new feature within an Allurin product that we have called Coach Iris, which is a 24-hour available AI-assisted virtual weight loss coach, which is now available for patients. Before jumping into the details of this Coach Iris AI offering, I'm going to start by talking a little bit about the role of digital within weight loss treatments today. A brief summary of the Allurin Virtual Care Suite, which is a tool that we have available to support both Allurin program patients, but also bariatric surgery patients, anti-obesity medication patients. But the majority of today's session will be talking about artificial intelligence and Coach Iris itself. I think as we're all very aware today, there are many different digital technologies available that can be used alongside weight loss programs to enhance and support care. This ranges everywhere from the telehealth and telemedicine tools, which particularly became more and more prevalent post-COVID. Wearable technology, I think many of us within the room will have an Apple Watch, a Fitbit, to be able to track and monitor our steps and our health. And also there's a general increase in the number of applications available for mobile health monitoring, tracking, fitness, food intake, nutrition, that helps to guide behaviors of patients. And what we see within the literature is actually the positive impact of many of these digital solutions. Firstly, with regards to efficiency, and we do see in some of the literature that many of these tools can help with enhancing the amount of weight that the patient is able to lose. We also see with the use of the telehealth and video conferencing, this can help with the adherence of the patient to their weight loss program versus just having in-person consultations alone. The use of telehealth can also have a positive impact on the cost, making potentially some treatments more accessible to a wider range of patients compared to a solely in-person solution. And then last but definitely not least, within one study, we saw that 95% of patients on a weight loss treatment program said that they would not have participated, they would not have been able to participate if the opportunity to use video conferencing wasn't available. So these plethora of digital tools and digital experiences are already helping patients to be more engaged with their treatments, and that is showing in their results. One study done by Dr. Raftopoulos from Greece using telehealth alongside the Allurin program helped to demonstrate that and showed with two separate groups. The first group received weekly follow-up, but this was not done in a telehealth conversation. This was done over a period of time, so not in real time. And the second group, Group B, had real-time follow-up virtually with the physician. What we found in the second group who had that real-time conversation and real-time support was that they saw a much higher improvement in their weight loss outcomes across all measurements within the study. This not only tells us that this real-time engagement and this use of teleconferencing tools has helped, but also the idea that having a rapid response to a question or to a consideration from a patient is something that could be very useful when we think about AI and how that could be integrated more into weight loss. So to touch briefly on the Allurin Virtual Care Suite, which many of you may be familiar with, and this is a comprehensive set of tools that's available, powered by artificial intelligence, to support both the patient and the provider. And this is something that is available alongside the Allurin program, but is also available independently to support bariatric surgery, weight loss medications, dietitian plans as well. The VCS consists of two main components. The first is of a patient app called the Allurin app, and this is a mechanism to track and monitor the data for the patient to be able to pull in their weight data, their activity data, their sleep data, and they can monitor and see their own trends within that app. And then that data is transferred to a provider platform called Allurin Insights, which enables the provider, the clinic care team, to be able to remotely monitor and track that patient and see how they are moving along their weight loss journey when they may be not meeting them in person. This ability to have real-time analytics around this patient enables providers to take course-corrective action if they see the trends are not moving in the right way, and also enables the patient to feel empowered with the data that they have. And this really is here to support this end-to-end patient management for the clinic. Built in within this is telehealth-powered follow-up that links the Allurion Insights platform with the app, so the patient and the physician are able to directly communicate within this tool. And we also have 2 key AI-powered features built in to help support those conversations. With the use of the virtual care suite, we do see some additional positive impacts to the patient experience and patient outcomes versus not using these tools. We see actual optimized weight loss with 11% additional weight loss for those clinics who are much higher users of the VCS than the average clinic. We also see an increase in patient engagement, and what we see in the literature that ultimately those patients that are more engaged in their weight loss journey are more likely to have better weight loss outcomes. And 82% of providers believe that the VCS helps to improve that level of patient engagement by allowing them to track, monitor, and follow during the app. And then last but not least, we had 88% of physicians believe that the VCS can enable more efficient patient follow-up, helping both to manage the patient journey, but also helping with some of the bottlenecks within the clinic that they had seen previously before adopting the VCS. I mentioned previously that the VCS is there to support the Allurion program, but also can support a plethora of other treatment options, and we continue to develop this product to enable to support better within more specific details around bariatric surgery, other intragastric balloons, anti-obesity medications, as we spoke about earlier, and also nutrition and diet plans. And we're collaborating a lot, particularly with dietitians, to be able to adapt the virtual care suite to be more supportive for those treatment plans and making it more adaptable. Within Allurion, we have a mission of ending obesity. I think similarly to the conversation we had in the previous discussion, this is something that all of us are in this together to help to achieve that goal. And we do firmly believe that AI can play a very important role in that. To quote our CEO, Shantanu Gore, just a few weeks ago during the IFSO conference when we did a pre-launch of our latest AI feature, we don't believe that AI is obviously going to replace physicians. It's never going to do that. But what may happen is those physicians who do not adapt AI and adopt AI into their practice may get replaced by those physicians that do look at AI and look at the opportunities and how that can support their clinic and their patients. So within Allurion, we created Allurion Iris, which is our AI platform. And here you can see 4 key areas where we are looking to utilize AI to support patients and to support clinics in offering a better experience for their patients, better outcomes for their patients, and also a more efficient clinic experience. The first of these AI-led tools is called the Success Predictor, and this is something that we launched in 2022. And this is a way to help to quickly and easily identify which patients on the Allurion program are not on track to achieve an average of 10% weight loss. And this can be tracked as early as 20 days into the patient's treatment journey. This will be flagged to the physician as a red flag, as you can see here on the screen. And this can then allow the physician to look a bit closer at that patient, to look if they need any additional support, and to reach out and create an additional plan accordingly. The patient is not alerted to this flag, so it's not trying to make patients feel like they are good or bad. It's really to help the physicians and the care team to see and identify where additional support is needed in order to help that patient to achieve their outcomes. When we did a survey of the current users of the Success Predictor, 90% of users felt that this really helps them to identify those patients, and 80% declared that this would help them to be more efficient within their practice, so altering their time to where the patients need it most. So this was the first step into AI for us at Allurion, and we're currently working on additional versions of the success predictor to support with other treatment types, because we believe that this is something that really can help you and your clinics to guide patients. But most recently, we have actually launched Coach Iris, which is the main topic for the talk today. And this was launched just this week, just on Monday globally, and is our 24/7 AI-powered weight loss coach, which is available for patients within the Allurion app. Before jumping into what Coach Iris is, I'd love to just give you a little bit of a background as to how we got to Coach Iris. Within Allurion, everything that we do is starting from a base of being data-driven. And so the journey for Coach Iris is not something that has just come recently with AI becoming very popular, very in vogue, and it's not sort of jumping on the bandwagon. This started a few years ago when within our internal behavioral science team, we started a study evaluating the positive impact, or hopefully positive impact, of a text-based human health coaching alongside the VCS to see how that would impact patient satisfaction and patient acceptability for that type of method. Within that study, we found that 82% of those patients found the health coaching to be useful via that text messaging feature, and 82% of people also felt that they were more supported toward their weight loss goals. So we understood that this use of a text-based approach, so not actually speaking to a human but having the text, could have a very positive impact on patients' experience. But the effectiveness of this was still limited by the fact that we had a human in the loop who had limited time, limited energy to be able to give to those patients. We also saw at follow-up there was a need for longer term and more personalized coaching. A very high proportion of those patients that were on this journey requested to continue with that support as they found it so useful, but the clinics weren't actually able to offer that at that time due to the limitation of the coaching. So this was the first idea for us that really made us think that we could leverage AI to provide this text-based coaching that would be available for them 24/7, that could be more personalized to that patient and could help to augment the clinic care. Outside of the Allurion's own study, there's also generally within the literature some early evidence about the use of artificial intelligence chatbots to be able to deliver a more automated text-based approach, and that these can have a positive impact on behavior change, which is ultimately what we're trying to do here with many of our weight loss programs. I'd just like to briefly show you a short video to introduce Coach Iris so you can see how it looks and how it can interact, and then we'll talk through a little bit more of the details of the product. from that video, I'd just like to pull out a few key highlights around Coach Iris and the way it's been built and how it can operate. So firstly, I think it's very important to note, compared to other AI tools that may be available, this was designed specifically for weight loss, and then also specifically designed by weight loss experts. This has been built using some proprietary technology by our internal Allurian behavioral scientists, but also in conjunction with other weight loss and weight management experts from across the world. And during our testing phase particularly, we had a lot of input from providers and from dietitian and care teams. Coach Iris has also been specifically trained on the Allurian program in the instance, so we would call her an expert on the Allurian program, but is also trained to answer or respond to questions around other treatments such as bariatric surgery. Coach Iris is able to provide this unlimited support 24/7, and what we see from patients pretty unanimously is every patient wants additional support, additional care, additional time with their care team. And the benefit of Coach Iris, it is there to answer whatever question the patient needs whenever they need it. Whether that's a Monday night, a Sunday morning, Coach Iris is there, ready and able to answer whatever it is that they would like to be supported on. Another key benefit is around the personalized experience. With the method of how Coach Iris is built, Coach Iris is not just providing a list of responses that has been previously programmed to do. It is learning from the patient with every conversation that it has in order to personalize the future advice and future guidance. Very early on, when a patient will engage with Coach Iris, it will ask questions around preferences, allergies, likes, dislikes, and then we'll take that further into any subsequent conversations. A key one here being allergies. If someone mentions an allergy that they have for a particular ingredient, moving forward, no recipe will be suggested that includes that ingredient. And very importantly, not only is it personalized to someone's likes, dislikes, and dietary requirements, but it's also personalized to their own language. So Coach Iris will respond in whatever language you speak to Coach Iris in, making it very flexible and available globally to support as many patients as possible. And then last but definitely not least is how patient safety has been kept at the core of the development of this product and continuing moving forward. We appreciate that AI can be very useful in augmenting and supporting, but it cannot replace the care that it can get from a physician, from a dietitian, from your care teams, especially when it comes to medical questions, where it's very important to understand the very detailed medical history that the patient has. Coach Iris will not try to respond to those patients and give that guidance. They will instead guide that patient to come back to you and your expert team to answer these medical related questions. As I mentioned, it's been key for us to keep safety at the core with the development of Coach Iris, and so we've actually, on top of previous guardrails, is we've developed a human-in-the-loop framework to monitor and review every single conversation for both safety but also accuracy. So we're continuing to monitor and learn and develop and evolve the responses that patients are receiving. We've built a custom-made quality framework internally, which helps to review many parameters such as safety, looking at clinical practice, behavior change coaching, and other safeguarding risks. And this is done by human monitoring. So we have an initial layer of self-monitoring by AI, and from that level we then have our own behavioral scientists, which includes a team of nutritionists and psychologists, who are then reviewing those conversations that are flagged to have some level of potential risk. These conversations are reviewed routinely by this behavioral science team, and when there is something identified that we believe should be raised to the provider, and this list has been aligned with physicians globally with feedback to understand what is needing to be raised and what can be remaining, is then shared by Allurian to the clinic for them to then decide if this is something that they need to act on, provide additional care, or if this is something that it's just good for them to know. A good example of this, what could be considered a risk, is around pregnancy. And we had this within the testing that we did with one of our clinics in London. where we had actually 2 patients who asked about pregnancy nutrition and what happens if I get pregnant during my Allurium balloon journey. With those two highlighted risks, we alerted the clinic. In one case, that patient had already told the clinic they were pregnant, they were already taking additional care, giving additional nutrition support, so that patient was covered and being well treated. In the other case, the clinic were not aware that that patient was pregnant, and as a result, this alert enabled the clinic to adapt their treatment program, provide additional support. So we really feel that this alert system is helping to give an additional layer of safety and an additional layer of comfort for the clinic team. And we've really seen this reviewing and monitoring has led to improvements on the safety side, but also the quality of the responses that we're able to provide to patients and the capabilities. From some of the conversations that we've reviewed, we identified early on some gaps where patients were asking something that we hadn't identified as a need. And therefore, we were able to build that into the technology and adapt accordingly. I've mentioned this previously, but I think it's such an important point. We continue to reiterate that although Coach Iris is many things and can be very supportive to the clinic, it is not a replacement for the care currently provided. It really is about an augment and additional support to make your patients feel more supported and potentially also improve efficiency for you within your clinic. I mentioned we did a number of tests before we launched into the market, worked with a number of providers and clinics across, mainly in the UK and Australia, due to initial versions being in English. And we released a pre-launch version initially to these sites, and then we conducted mixed method research to explore the patients' views, whether they were accepting of AI initially as a concept, and then how that was related into the use of Coach Iris, how acceptable they were to this as an idea, the feasibility of how they would use this, and also the safety of how Coach Iris was responding to real-world patient questions. We were, to be honest, positively, overwhelmingly surprised by how positive the feedback was, and we were looking for more mixed feedback to be able to add additional benefits and evolution. But we saw in all of our research that 100% of our patients surveyed felt that Coach Iris was giving them the information that they were looking for. It was filling the gap that they had with their information that they didn't have, and it was also very easy to use, so very accessible for all of the patients. 94% were satisfied with the quality of the support, and they felt that Coach Iris responded quickly. The reason this is a good highlight is very early on in the testing, we noticed the response time was quite slow, which caused some frustration for patients. So this was something that we took the feedback, we enhanced, and then we got to a point where patients felt that response time was quick. And then 89% felt that Coach Iris was safe and trustworthy. It gave them that personalized approach that we were aiming to do, and that they would continue to use it and recommend to friends and family. So again, they're finding the value and they're using that accordingly. One of the very key things that we also wanted to work on when it came to the patients, as we know, patients on weight loss journeys can be, many have been on a very long journey with highs and lows, and it can be very sensitive how you have those conversations. It was mentioned briefly in the panel earlier around that sensitivity and having those conversations in the right way. And so this has been a key focus of the words and how we approach patients by Coach Iris. And when we asked the patients to provide a way to describe the responses they've received, 100% of them chose positive words only. So words such as non-judgmental, understanding, friendly, knowledgeable, empathetic. One patient described Coach Iris as like a big sister or a mother type figure who didn't judge you for any of the questions, even if it was a silly question. There was no judgment, and they felt supported whenever they needed it. This is just a collection of a few of the spontaneous quotes that we received from patients. The first is a first indication about how Coach Iris may have a positive impact on weight loss outcomes. This is still something we're monitoring over time, and we'll be happy to publish more data on this slightly down the line. But one important piece I think that we've really learned from the quotes from our patients is that they wish they knew about Coach Iris before they had their Allurium program balloon fitted. As we know, for most treatments, whether that is Allurium balloon, whether that is anti-obesity medication, or even bariatric surgery, those first few days, weeks after that treatment begins is when people have probably the most questions. And so this is a really peak time where we see this can help support patients, whatever the treatment type that they are working with. To move to feedback from our providers, this is a quote from Dr. George Vassilikostas, who works in the GV Weight Loss Clinic in London. This was the first clinic that we actually partnered with to start the testing initially. And really the benefit that Dr. Vassilikostas found was in the efficiency, by Coach Iris answering many of those questions that are quite standard. It allowed his team to focus their time on those patients that really needed more support. So they were able to streamline their offering. They still had their regular monthly follow-up appointments, but that time in between was better spent with those patients who had the bigger challenges. During the IFSO Congress at the end of August, we did a pre-launch of Coach Iris and again gathered feedback from physicians attending that Congress and from people receiving a demonstration, understanding how the technology worked. We had, again, an overwhelming positive response that 100% of the physicians that we surveyed felt that Coach Iris could augment patient care, could maximize the experience for the patient, bring some efficiencies to the care team, as shared by Dr. Vassilikostas, and would ultimately help them to treat more patients by making them more efficient in the approach that they give. At the bottom you can see a quote directly from one of our clinics in Italy, who really agreed with those sentiments and felt that this is going to be an easy and accessible way to support patients on a larger scale. So if we think of all of the information, all the learnings that we've seen and all of the insights we've gathered in the past few months whilst testing Coach Iris and developing it, we can really split those key benefits into two buckets. So for the patients, really providing an improved experience, enabling them to feel supported at all times. They have this 24/7 support to educate them, to inspire them, to motivate them whenever they need it, and is a perfect adjunct to their current clinical program. And we also see an improved engagement in their weight loss program. And as we mentioned earlier in the presentation, we see in the literature those patients who are more engaged in a program will ultimately have better weight loss outcomes. And for the clinics, two key benefits is the efficiency, which we just mentioned, helping the clinic team to be more productive and focus on those patients that really need the help. But also from a more commercial perspective, can enable the clinic to differentiate their offering versus other practitioners around them. It's an additional value to the patient, this idea of a 24/7 support without a high additional level of commitment from you and your team. We do believe Coach Iris can be very successful in supporting clinics, but we do believe there is an onboarding process that would need to be done in order to maximize this. And again, we've seen this with our experience with patients so far. So our commitment alongside providing the AI technology is understanding that this still needs to be delivered alongside a full training program to the clinic care team to help them to understand the best way to integrate this in with their standard care protocol, and also to enable the education to the patient in the right way. Coach Iris is only useful if the patient knows that it's there and knows how to use it. Also, this is not the end of the AI. As we all know, AI is evolving every day. Just last week, OpenAI and ChatGPT announced a complete shift from their technology overnight, from referring to data from 2021 to now being up to date with live what is happening in the world. In the same way, Coach Iris and Allurium's AI technology will continue to evolve, and although we're just launching this feature, it's really just the beginning for that evolution. And the way that we will evolve that is from the feedback from patients and feedback from providers to enable us to evolve to better meet the needs of patients, particularly on other treatments such as bariatric surgery and anti-obesity medications. And in the future, what we'll be looking to do is to provide greater visibility to providers on those conversations beyond the patient alerts that we talked about before from a safety perspective, to enable the care team to be more educated and more aware of the struggles that their patients are having and potentially adapt their programs as a result. So with Coach Iris, it's available within our VCS Plus and VCS Custom tiers, which we have, which have not been available previously in Q8, but will now be in the future. As I mentioned before, an important question that we've had from a lot of members of the Congress of the last few days is around language. So just to reiterate, it is able to support all languages and will respond to any patient in the language that they speak to it in. Available across all platforms, which is also critically important to make sure there's no patients left behind. And as I mentioned before, it's optimized for the Allurium program, but also is able to provide general lifestyle support for other treatments. How we've trained Coach Iris is that it will know the treatment type selected by the patient and it will adapt its responses accordingly. So for example, if a patient talks about a symptom challenge, it will not automatically assume they're on the Allurium program, for example. It will look back to see where that patient sits, and if it's an Allurium program, if it's another intragastric balloon or bariatric surgery, it will adapt that response. And as it's more of an expert on the Allurium program today, it will give more detailed responses. On a bariatric surgery, for example, particularly on medical or clinical questions, it will direct that patient back to the clinic to ensure that safety and it's providing the right support. But as Coach Iris evolves, as it develops, as it gains more knowledge, it will be able to provide a higher level of support to those patients as well. As I mentioned, we have Coach Iris available in the VCS Plus and VCS Custom tiers. I just wanted to share this briefly just to show that Coach Iris is a key feature, but also we have a number of other behavior change tools such as My Daily Actions, which is a way for patients to select a behavior change process to integrate into their daily life and again monitor and track it through the app. And also the telehealth features that we mentioned earlier on in the lecture, which we know can help to ensure adherence of the patients to their weight loss programs. The tier on the right called VCS Custom, this is something that's available for our generally larger clinics who can have the Allurium app actually personalized to the branding and the look and feel of your clinic, and also can add personalized treatment types. This is something that we've launched relatively recently for a few clinics in Europe, but is something that can be available to again further augment the experience for the patients. So in conclusion, what we see is the role of digital care within weight loss is continuing to increase, and this is really due to the patient needs and the complexity of what we're seeing. The advancement in AI technologies are expanding how we can do this in both a safe and accurate way without adding additional heavy burden onto you and the clinics. The Allurium VCS does provide a solution powered by AI to provide this full support platform from a patient perspective for tracking and monitoring, but also for the clinic to enhance the care that's provided and have a positive impact on those weight loss outcomes. And within that VCS, we believe that Coach Iris, this new feature available, is going to really enable us to change the game in how AI can transform patient care and maximize clinic efficiency. And this has really been our goal in evolving this feature to support providers such as yourselves. Thank you for your attention, and I'll open the floor if there's any questions at all.
Jen, thank you very much for giving us this rosy picture of artificial intelligence in healthcare. There's a dark side to it. You never said anything about it. I don't need to call a KGB or a CIA team at home to bag my house. It's already bagged through the Alexa device. Mercedes has bagged my car. I just press a button and I connect to the service center that I'm in trouble. And there's a microphone. And they hear anything I say. If I say the word bomb, it flashes an alert somewhere. Now, when a doctor sees a patient, cannot disclose any information about this person. It's a sacrosanct confidentiality. When I put my name, my email, my weight, my height, I give a lot of data to your company. How do I make sure, how do I know that your company does not share or will not share this data with any other platform? That's the critical issue with AI. Whenever you buy something, you get a very long list of, which you never read because it's very small letters.
Yeah.
Mercedes regularly update me changes in there, and I will never read and say I agree. I know these are not for my benefit, they're for their own. But in healthcare it's critical because if this data, for example, is shared with insurance companies, may affect premiums. As you saw, Iris was replying to Joy, you like bananas, you don't like celery.
Yeah.
The girl who was pregnant, the clinic was alerted, but the young girl here may not really want to alert the clinic if this is an occasion. So how do you make sure that these things do not happen when the patient submits it?
It's a great question, thank you, and it's a very important topic. If I take the virtual care suite to start with originally and then step onto the AI, so we have focused around patient safety, data safety and security, and we adhere to all GDPR within Europe. We have our ISO certificates around our data policies to ensure that we are controlling data in the right way. We are not sharing that patient data. As you say, we do have licensing and privacy agreements that we do ask both our physicians and our patients to sign. And actually, when going into Coach Iris, we do highlight 4 key reminders for the patient of that their data their conversation, will be potentially shared with the clinic if it's needed to be raised, and it's a reminder of some of the key pieces within the data policy. But we, as a company, do not share that data. There is very limited people within Allurion who have access to potentially even see that data. I've worked on this project since infancy, and I have zero access to any of the direct patient data or ability to see that. With the alerts that we provide to the clinic as well, our team do not see the patient, they do not see the individual information, they see the confirmation and a patient ID, which they are not able to actually link back to the patient. We provide that to the clinic, who are able to monitor that and track that in their system. So it is something that we take very seriously. We have put as many guardrails as we can within our company to keep the data as secure as possible, following all of the data privacy rules and regulations, and we continue to review and update those as those advance in many of our countries around the world as well. Thank you.
So I've got a few questions, if you don't mind. AI is obviously coming to the world and this is going to be the way forward for everyone. But in medical terms, AI is only as good as the information you feed it. So my first question is, what is the database that this AI is drawn from? Because if you feed it wrong information, it's going to come out with wrong information. So if you tell me, there's a recent, I think, article on JAMA that says AI, if you ask ChatGPT or OpenAI, one of the other, I'm not sure which one is it, that a third of the questions medical related to cancer came back as inappropriate.
Yeah.
So they were either wrong, they were either missing information, because obviously the internet is a big area. So that's a major concern. What is the quality control? So that's the number 2. What's the quality control on this? How do you monitor that the responses are actually appropriate? They're not missing information. So a lot of the previous panel was talking about misinformation a lot on the social media and all of that. We don't want this to propagate as misinformation as well. We're endorsing it to our patients as a good tool, and then coming back to us with a lot of misconceptions and misinformation. And you've spoken about the feedback from the patients, that it's great and everything. Yes, the patients will feel great about it, but there aren't a lot of professionals, either physicians, nurses, dietitians, that you tried this out and said, yes, it actually is giving appropriate information. So I don't know if I've got any comments or.
That's okay. Yeah, thank you for the questions. So to start, initially the first question. So Coach Iris is built off of a base language learning model, which we have then added in the proprietary technology and proprietary learning around weight loss in general, and particularly medical weight loss. As I mentioned, it has been educated and taught, particularly on the Alluring program as a first instance, about everything that we train and educate our physicians, our providers on. Coach Iris is educated to the same level of information. So for the Alluring program, we would say it is an expert in all of those responses of the key questions and key areas. For the other treatment types, we are building Coach Iris's education, but for now, what we have is, as I mentioned, it can identify the treatment type and therefore adapt the responses based on what's most appropriate for those treatment types. So particularly around surgery, I would say today it is limiting anything around a more medical or clinical question, and it has been trained to identify that this is a medical clinical question and direct that back to the clinical team rather than attempting to answer something that may be inaccurate or not ideal. The second piece we have is our safety monitoring and our human-in-the-loop monitoring that we have built in. This we feel is something that's a critical step that we will not compromise on to make sure that we are not just letting conversations happen. We will continue to monitor those conversations. Right now, we are just launching, so we have a relatively small team supporting that, but we believe that will grow as Coach Iris will grow. So we are still, monitoring every single conversation from a safety perspective, so anything that we believe is wrong or potentially dangerous, and also from an accuracy perspective. So if we see something that is not, is providing strange advice or incorrect advice, and that is being reviewed and continue to be escalated to the clinic if we notice that happening. So far, in all of our testing and our initial release this week, and we've sort of every day is increasing the number of users, we have not seen anything where it has been, if I can use the word, sort of dangerous from a safety perspective. We've seen areas where the response could be optimized, could be better, but not anything where it's been really wrong or dangerously wrong. So I say so far, it's AI, it's evolving, but we've seen that in all of our testing, as soon as before we got to a patient, we had that back end. The other piece I will say on safety as well is we started with incredibly tight guardrails because we wanted to be conservative. We wanted to make sure that we didn't have any safety risks or minimize any safety risks. And as Coach Iris has evolved, we have slightly released those guardrails because the quality of the responses has been good enough that it's supporting those patients. But those guardrails still remain there, and we'll continue to monitor those. And if we see anything, we will obviously adjust them, either tighten them up or maintain them as they are today.
Yeah.
I apologize, I've forgotten your third question. I'm so sorry.
You've surveyed it's all related almost, so you've all answered it. I just need one follow-up question.
We need to go to the next session.
Just 1 second.
Yeah.
Let me ask it in a different way. I'm sure you've heard about IBM Watson.
Mm-hmm.
So this was one of the biggest AI programs that hailed as excellent, but when applied to the medical field, it's failed miserably. So how does that differ from this?
I think it's what we've seen is the fact that we are really focusing. This has been built for weight loss. This has been built with that in mind from the very, very beginning. So it's not been taking something and adapting it down the line. The proprietary technology has been built only around weight loss. So I think that's where we see the difference, is that focus from the beginning rather than taking something and trying to adapt it later down the line. So I'd say that's been our experience so far. I know you mentioned at the moment it's a limited number of physicians that have been involved. I completely agree with you. And that's something, as we're expanding, in the last week, we have, I think it's probably quadrupled the number of clinics using it just in the last few days. And so we're working closely with those physicians to gather more feedback, gather more understanding, and we'll evolve as a result of that.